Great. Hello and welcome, everyone. I'll give you a few moments here for us to start presenting live on Facebook and for attendees to sort of come through and join. 2 seconds while I post this up here. But welcome now to the last day of the Trade Decorator Festival. It's been a whirlwind couple of weeks. It's been fantastic engagement. We'd love to hear what have been some of your highlights, perhaps during the last couple of weeks. And I think one of the highlights for me today, and a really timely highlight as well, given that it is World Mental Health Day tomorrow, is the discussion that we're about to have here with yourself, with Martin, who's from Mates in Mind, which is an organisation really focused on making mental health a priority in the workplace. So welcome, Martin. Martin's responsible for the growth of the organisation and for spreading this good message. So Martin, thank you so much for coming along.
No problem at all. Thanks ever so much for having me, Ben.
Absolutely, brilliant. So while we get this sort of Facebook Live page set up, could you just give us a bit of a overview of what is Mates in Mind, the charity, a bit of the background and your role?
Yeah, absolutely. So we're Mates in Mind. We're a mental health charity. We were formed back in 2016 from a partnership with the Health and Leadership Group in Construction and the British Safety Council. Had identified a real need, specifically within the construction industry, to really look at the mental health provisions available to that sector. They were felt that perhaps they weren't really focused on the industry itself. The options and opportunities that were available in the market didn't quite fit with their work. And Mates in Mind effectively were born out of those discussions and through piloting various schemes. Today, we work with probably just under 450 UK construction companies, from the likes of Tideaway, Bovis Homes, all the way down to the self-employed and SMEs. And basically our aim ultimately is to raise awareness and understanding of mental health and help remove the stigma of mental health in the workplace and help organisations really put together more of a bespoke programme of understanding around mental health to really support their individuals. My role in Mates in Mind effectively is growth development. So I'm here really trying to reach out to more and more organisations with the message around the importance to organisations of mental health, not just for their individuals and their employees, but also from a business perspective as well, and how really addressing mental health can also improve business performance. And that's my role within Mates in Mind.
Brilliant. And for those listening, are there specific sectors that you are focused on?
Yeah, absolutely. We were really incorporated to kind of look specifically at the construction industry. Unfortunately, even today, of the 16 suicides in the UK every day, 2 of those will come from the construction industry. And so it was really felt that and there was a need for a mental health specialist to become involved in that sector and really start to work and understand why and what the need was and how we could really change the approach to mental health. And so, as I say, we start putting together a program that could be bespoke for relevant organisations that started to build up a culture of peer-to-peer approach and letting people know, guys on building sites, construction sites, know that it's okay to talk about mental health and try and remove that stigma. Subsequently, we've kind of grown and we now work a bit further down the supply chain as well and started to work with a lot of transport and logistics organisations and moving into warehousing as well, because obviously there's a nice synergy with the work that we've done within construction as well.
Absolutely. And is that, have you found, people to be quite receptive to this message? How have you found it?
Yeah, I think as you would imagine, there is the stigma or the preconceived idea about guys not wanting to talk about mental health, the feelings. It's something that we all kind of want to put to a side and don't want to discuss. But what we've actually found is the opposite, and the actual introduction of mental health and getting people to speak about it and letting people know it's okay. People have really taken to it, and we're really, really proud as a charity that when we go out to building sites and when we speak to people, we get so many people saying, we've seen your logo, we've been through one of your training programs, You know, we don't even work for an organisation, but we've been on site to deliver some work, and we've seen your posters and your signpost, and that really is a charity, is what we want to achieve. We want to be visible, which is great, and we want people to talk about us. So again, it encourages them to then talk about the subject of the issue.
Brilliant, brilliant, and that's also for small businesses as well. You know, is it for individuals or for larger organisations generally?
Yeah, well, we work with both. Basically, what we wanted to do was be available to everybody. We didn't just want to be exclusive to those organisations that perhaps had more time and more financial power, that could invest in a program and use the EAPs and occupational health and everything that they already had in place. So we put together a program that is very much bespoke to organisations from, as I say, self-employed and SMEs all the way up to those multinationals. And basically what we do is we ask people to become supporters of our charity, and we provide you with the tools and resources to actually start to develop your own program, regardless of size of the organisation, just to get the information and tools that you need.
Okay, okay. And those information and tools, what could you share some examples perhaps? And how is it sort of different maybe to any of the other organisations out there?
Yeah, and again, I think where we probably do differ is we believe that mental health, and within the workplace in particular, it's got to be more of a cultural change. There is no silver bullet training course or poster that we could give you that is going to make everything A-okay and everything will be fine with that. It's got to be an ongoing cultural change. I think where we differ is we give the opportunity for all organisations to actually run an assessment with us and actually get feedback from one of our practitioners as to how we could start a program, regardless of where you are on maturity level, and actually start to build in the elements that you need. And one of the really things, one of the elements of our program that we're really pleased with is our training pack called Start the Conversation. Okay. It's a 45-minute general awareness training pack. It's about recognizing mental health in yourself, spotting the signs in others, and then how do you start that conversation? And that's available to all of our supporters, big or small. And it really helps people just understanding themselves, spotting the signs in others, and really cultivating that culture of asking people how they're doing, and asking people if they're okay, and starting that conversation. So we're really proud of that element of our program as well.
Great, and it's something we'd love to get some questions from people listening to this as well as we go. But perhaps we could just give us, before we do that, Martin, sort of a bit of advice, you know, for businesses. Maybe some organizations have started that conversation, maybe some are a bit further down the road, but what would you say is important, you know, right now for people to check in terms of mental health?
Yeah, I think at the moment, particularly through COVID, it's perversely, it's actually had a beneficial effect in regard to mental health, because I don't think the mental health discussion has ever been more prevalent. And I think that's because everybody has been in the same boat. We've all felt that sense of isolation. We've all been kind of locked away through this COVID environment. And so we've all felt that different kind of change, and a different way to our life has been affected. So everybody's had that kind of same experience, and has really encouraged people to speak about mental health. From an organisational perspective, we'd always recommend that companies take stock of what they've got, where the signpost in, really encourage that culture of open discussion about mental health, remove that stigma, really get people talking about it, and lead from the front, regardless of size of the organisation. Show your employees that it's okay to talk about mental health, and it's not something people are going to be judged on or cast aside because of. We really want people to know that it's okay to talk about mental health.
And I suppose that's one of the big challenges, isn't it? Is actually getting people to feel comfortable because it's okay. And one of the ways to do that is, you know, by understanding that other people are doing it. We're sort of very social animals in the way that we're influenced, aren't
Absolutely.
we? You know, maybe without, I guess, giving away too much any personal or identifiable information, talk a bit about an example, you know, or two of conversations that maybe other organizations are having that might inspire people.
Yeah, well, we've got quite a few different examples, but again, what we really like to hear are the positive feedback we've actually had from courses. People come back to us and say that the training has actually been life changing, life saving, because unfortunately, if there isn't an outlet for people to talk, mental health can reach a critical stage, as we know. And so that's why it's so important that we want it to be more of a preventative, more of a proactive approach to mental health rather than reactive. And so we get so many examples of people coming to us after our training, after putting together a program of their own, and saying that it's really helped kind of have this initial discussion, no matter how big or small it seems. Actually, even having that discussion where it's not registered before is one of the really great starting points. And again, that's why we really want people to kind of engage with mental health and realize that it's okay to talk about this subject, not taboo.
Absolutely, brilliant. So maybe I'm not sure if we can get some questions either through the chat from anyone listening here or on the Facebook Live page. I'm looking at both, and I know that on the Facebook Live page it's a little bit delayed from our conversation, so it might take a little bit of time for some questions to come through. So I can ask one myself from sort of my own experience here, but if you've got any kind of advice for people also to, who perhaps manage other people in this way, so people with line management, what's kind of the best way to start firstly having that conversation? Would you always recommend kind of bringing in a third party to support that, or
no? I think one of the recommendations that we have for organisations is that they should look to upskill managers to make them feel comfortable in discussing mental health. We encourage people to speak about mental health as regularly as they can. So it's not just we need to speak about that subject. Incorporate it into things like regular one-to-ones, performance review, even in inductions. You can start and show that right from the very beginning of a person's experience with your organisation, mental health is part of our culture here. And so we're going to have a form of general awareness. We're going to speak about it. And so it's really, really important that you kind of cultivate that. From a manager perspective, it's really important that, again, managers kind of are comfortable and understand about speaking about mental health in a relaxed environment. So it's not a formal, right, we need to speak about mental health, and this is this, and I'm going to record it, and I'm going to then pass it on to HR. And it's really about having that chat. Let people know that you're relatable, you're a human yourself, and that you want to listen and talk. And it's very important, again, to listen to what's being said and let the person talk about their experiences.
And it's quite a different set of skills, isn't it, that in terms of management perhaps than people are used to? Is that what you're finding with organizations?
Yeah, it is. We still find that a lot of people kind of avoid the actual subject because they really don't feel comfortable discussing it. And again, that's part of our program, is to really make people a bit more comfortable and realize that this should become more of a regular kind of conversation.
And what are there any other sort of barriers in terms of, if you like, the skills that people have? Is it like a lack of being able to communicate, or is it maybe sometimes more of a cultural challenge where, being that human, authentic person is quite difficult, isn't it? We have to put a, professional face on at work, and we're worried if we appear to, soft or show our vulnerabilities, then
absolutely. And I think that's one of the things about being a manager. It is recognizing signs in people, spotting the signs in people, spotting if somebody's not okay, and actually reaching out to that person to have the conversation. A lot of the times it is confidence. It is about the concern, about saying the wrong thing, not wanting to talk about it, because although they can recognize the sign, they don't particularly want to say it. And we've had an example previously where a senior manager actually was really struggling with their own mental health. And about a year later, after they'd actually come through it and been through it all and had almost lost their business, one of their senior managers and colleagues that worked with them for years before had said, oh, when it actually came out that it was a mental health issue, had said, I did think, a year ago that there wasn't something quite right. And at that time he thought, why didn't I just ask? Why didn't I reach out and say, are you okay? And can I help? And again, it is that confidence about actually speaking to people that's so important. What we know are people are far more likely, it's human nature that people are less likely to actually reach out to support services. And that's why you see things within organisations like EAPs, where there might only be an uptake of, I think it's on average about 4% of people. Right? And it's because people are less likely to actually think, I'm going to reach out to that. Whereas if somebody's reaching out to them, then it just makes the conversation a bit more easy.
Yeah. And are there, key signs perhaps to look out for that people can?
Yeah. I think again, and this is why we really wanted to encourage a peer-to-peer approach, because you work with people day in, day out. You spot when somebody's a bit more quiet than usual, withdrawn, not wanting to interact, not wanting to be involved in perhaps the usual discussions. Conversely, sometimes somebody might be a bit more almost, I don't want to say manic. They might be a bit more energetic than usual. And on an ongoing basis. And I think that's then really where you'll spot if that's kind of continuing, then it could be a good time to ask if they're okay.
Yeah, absolutely. Because I mean, I've seen some research recently about sort of burnout, but that certainly seems to be kind of an under discussed topic. And then also, you know, we're talking about quite like horrific and serious consequences for people, aren't we? You know, not just sort of depression, but suicide and.
Yeah, unfortunately, and I think even on the news this morning, I was listening and seeing that it is reported that the cases of depression have almost doubled through the COVID issue. So it's a real concern. More worrying for us, I suppose, as a mental health charity, is that it's reported that actually of those people that unfortunately commit suicide or take their own life, only 27% of those have actually reached out to a mental health service in the year before they actually do take their own life. And so again, that kind of proves that people aren't comfortable reaching out. They're not talking as they can. And again, that's part of the Mates in Mind program. Part of our approach is we don't just want to be a training or a poster. We want it to be all encompassing and a real approach to it.
And so there's a very clear, I guess, just, you know, human and compassionate imperative for why this should be a priority, you know, in the workplace. I guess could you also maybe talk a bit about the business benefits? Because actually, you know, obviously, as well as you know, just the clear case of looking after people that you're working with, that are colleagues and friends, and, you know, people that we care about. You know, there's probably quite a business case to be made for actually investing time and investing money in taking this seriously.
Yeah, absolutely. I mean, from a business perspective, what we all want is our staff to be engaged and as productive as possible, and present and enjoying the work and really, you know, producing what we need. Unfortunately, the most recent HSE statistics show that 54% of all working days lost can be attributed to stress, anxiety, and depression. 54% of all working days is huge, a massive cost on the British economy. And so if we can be more proactive in our approach as an organisation and actually reduce those absence days and have people in work and have people active, then that can only be good for business. Part of the reason for people not really addressing that, again, is that perhaps organisations don't give people the opportunity to speak about mental health. And it's reported again that 60 to 90% of employees give a different reason to being off. Even though it's a mental health case, it can be flu, the bad back, whatever that may be. And again, that's because people often don't feel comfortable or confident enough in their organisation to actually report, it was stress, it was depression, it was anxiety. Because then we can actually look at what's causing that. Is it a job thing? Is it a job role? Is it a description that we can help and change? Or is it a personal issue that we can try and support with and use our EAP or our support lines that we might have to actually help this individual through the situation? So there are real business benefits to actually tackling mental health, as I say, purely looking at the absence days lost due to.
Yeah, and I bet you must have been seeing as well in the last few months with the pandemic, and it just creates an environment of heightened anxiety, doesn't it? And heightened stress just in the background, kind of a shadow stressor, which makes kind of more like the incidents or the triggers, I suppose, even more likely to, unfortunately.
Yeah, and I think there's still a lot of research being done as to the effects that COVID are having, but initial things we're seeing slightly altering problems. So presenteeism is a real issue because people have got concerns about their job. So people are working longer, but perhaps aren't as productive. They just want to be seen to be there and involved. And so there's a number of different issues, and people obviously have got concerns about their own physical health. The virus is still out there. The cases are rising again. People are nervous about being in a work environment and taking something home to the family, which again causes people great anxiety. So you're absolutely right that the whole COVID thing, it's changing the picture, it's changing the view on things, but again, it's having a really, really big impact on our mental health.
And I wonder, what about also just the kind of isolation maybe that people are having to be, or you know, with the whole social distancing that we've got in, that used to be perhaps one of the things that I know improved our mental health, didn't it? It used to be something that we really value. You know, I don't know if there's any advice or kind of guidance that you give sort of around that. How do you kind of make people feel like they're still, I don't know, part of a caring community or connected
Yeah,
with?
I mean, isolation for us as a charity that have worked predominantly in construction and with transport and logistics, we've seen isolation as actually one of the causes of poor mental health. You know, people are away from home long period of times. They're in their accommodation, or there might be a driver that's on the road for a long period of time away from friends and family. And so it's really important, again, to have that kind of network of people, whether that's work colleagues, whether that's friends, family, that you reach out to, contact and have discussions with and talks with. Try and keep in touch with people. I think it's a lot easier these days to keep talking to people, but again, I suppose you want to try and have as many discussions as you can, which is very difficult in this day and age. I think we've got Zoom, Teams, all of these modern wonders these days, but you know, unfortunately, we are all slightly restricted, and some more than others at the moment, in actually reaching out face to face and having discussion with people.
Yeah,
but, try and keep in touch with people where you can.
it is, isn't it? But there's the kind of Zoom fatigue, and hopefully people aren't getting it too much now. Hopefully,
yeah.
Facebook Live. But yeah, the Zoom fatigue is sort of quite a real thing, isn't it? And just being a bit more compassionate, because I think that's ultimately, if I try and get to kind of the bottom of, you know, your message and where some of these problems are coming from. Yes, we've got the pandemic, and that creating, you know, this, making this a real priority at the moment, but it was already there, wasn't it? It was already there before the pandemic. It was already a real problem which wasn't discussed enough, and there were real challenges in organizations. You know, culturally, you mentioned presenteeism sort of there, but like culturally as organizations, we need to try and change, don't we?
Yeah, absolutely. Yeah. We need to recognize, obviously, mental health in the same way that we do physical health. You know, doing a course for a day and thinking that it's solved is not good enough. We want people to really look at what they've got, have mental health policies in the same way that they've got physical health policies, have a plan, have a long-term 3-year plan about what you want to achieve. Give access to all of your staff, general awareness training. Let everybody be aware about mental health and recognizing and spotting the signs in the colleagues, so that it becomes second nature to speak about mental health. We really want leaders to kind of talk about it, recognize it, look at how you record absence data. Do you allow for the recording of mental health? Is it discouraged? In which case, again, it's putting a stigma on mental health. So there's a lot of things people can do, and we really just want people to look at it and think about it and realize the value of improving employees' mental health.
And in terms of things that people can take away, are there any, you know, examples of companies that you could actually almost point to and say that you think they're doing a great job? Or
Yeah, I think to be honest with you, as I say, the 450 or so organizations that we're working with, what we don't see anymore, which is brilliant, are people just saying it's mental health, we're not really that interested, move on. What we do see is everybody is trying to do something, and whether that's Fruit Friday, whether it's an EAP, whether it's a yoga session, whatever it may be, there's genuine effort to do the right thing, which is really, really encouraging. What we do as a charity is really work with organizations to kind of bring that together, bring it into more of a holistic program that's going to work for the company and actually have tangible results. And so people engaging with us straight away is a really, really encouraging thing. And then it's just, as our role, we see it, is to provide the support, resources, tools, and real encouragement to actually really put a program together.
Brilliant. And for those sort of resources and those tools and that support, I guess obviously they can contact you and we can give people those details, but where else should they look for sort of more information?
We've got a lot of resources, obviously, with it being Mental Health Day tomorrow. There's a lot of resources via our social media that are going out at the moment. Our website, we always try and provide as many free resources as we can. So there's a lot of things specific to COVID as well that you can actually access via our website. There's our contact us form on there as well. Any questions, any concerns, please reach out to us. If you want to find out more about what we actually offer as a charity, again, complete the form, and one of our support managers will be in touch to actually discuss what we can do and how we can help and go through that process with you.
Brilliant. That's fantastic. I mean, do you want to just even give a sense of sort of, you've got various partners, I think, that you work with as well. I guess, is it sort of social enterprise and things that you're running? Do you have different levels of support that you can give to people?
Yeah, so within our program, we work with various different partners. So, for example, we work with the National Counselling Society, and that enables us to offer all of our members a counselling session for their employees, because we realise that perhaps not everybody is going to feel comfortable speaking about mental health in the workplace, or to their boss, or to their friends even. But this gives them access that they can actually reach out to a counsellor and have a session, a free session that first time, to actually speak about any issues that they've got, and then they can get ongoing sessions at reduced rates as well. So there are a number of different things that we work with, and we're starting to work a bit more in partnership with various trade organisations. And actually, if you look on our website as well, you'll find that we do have a number of free courses specifically for organisations with less than 250 employees. So people can actually register and go through one of our general awareness employee courses and actually listen to the kind of information that we provide with one of our practitioners.
Brilliant. So that's free courses, as it started for people with employees with less than 250 employees. So that could be quite a lot of people listening. You can go and access that, and what a great place to start with a very important conversation. And anyone sort of listening back to this session afterwards as well, World Mental Health Day is, of course, Saturday the 10th of October. Are you doing anything in particular, Martin? I don't know. Is it a celebration? It's an awareness day.
Yeah, it's an awareness thing. Yeah, we again, as a charity, we're doing various different social media posts. We've provided our supporters with a lot of additional resources that they're utilising and promoting within their organisation. Again, the more support that we can get, the more people that can tweet, retweet, like, whatever it may be on these various social medias that I'm not quite involved with as much, please do, because the more people that we get behind this and raise the message, the better.
Excellent. Brilliant. Well, I'm sorry we didn't get sort of into any of the questions. It might be because the feed was slightly delayed on the Facebook page, but we can always take those, I think, afterwards and on Facebook. And I'm sure, Martin, you'd be happy to get in touch with people, won't you? And we'll post out some links and things as well to those resources. So that's Mates in Mind. Is that matesinmind.org, I think, is it?
.org, yeah. That's right.
.org. Yeah. There we go. So head to there and good luck, and hopefully we can do a good job here in spreading that message. So Martin, thank you so much
thank you again for the time, and thanks to everyone for tuning in.
Brilliant. Absolutely. And this has been the Trade Decorator Festival. Wish you a happy Friday and a wonderful World Mental Health Day tomorrow. Thanks everyone. Thank you very much, Martin. Bye bye.